Hi, Chair.
Le kae, sir?
Hi, Chair. How are you?
Hi, how are you, sir?
Good.
Are we a quorum?
Good morning, Chairperson. I do not think you need a quorum because it's a committee strategic planning session and not a committee meeting.
Okay, thank you very much. It's 11:21. Good morning, honorable members. Good morning, everyone. You are all welcome to our meeting today, the 12th of October 2020. I hope you rested a bit during the recess. And then we are back to business. And then, yeah, good morning. Hi. Hello.
Good morning, Chair.
Good morning, Madam Chair.
Morning,
Yeah,
Chairperson.
okay, thank you. There is now a mobility in the group. You are all welcomed. Are there any apologies? Was Tembi able to connect? If not, Nokwazi, are there any apologies?
Yes, Chairperson, there are apologies. Tembi is unable to speak from her laptop. She has speaker issues. But we received an apology from member Lasindwa, who has a prior scheduled meeting with the PCO. Member Takile, who is, his meeting is clashing with his exam schedule. And then also member Dilange, who's not going to be able to attend due to a prior commitment. Member Mabunda has also requested to leave the meeting early. Thanks, Chairperson.
Okay, early what time?
Chair, it has not been indicated, but I will try and check with him and I'll get back to you.
Okay, thank you. The apologies are noted. We now move to the purpose of this meeting. The purpose here is to review Q3 and Q4 of the committee's OPP as well as for 2020-2021 OPP. The committee's operation plan will be a reflection on performance which the Health Portfolio Committee will endeavor to deliver. Members to kindly participate by providing valuable inputs on all activities to be undertaken by this health committee, a very important committee in Gauteng. So without any wasting of time, we move to item 4, the review of the committee's plan for 2020-2021 financial year. Can I ask Non-Dumiso August the opportunity to present, and I request that as members, let's note areas of concern, because in this meeting we do have senior management of the Gauteng GPL to assist in addressing those questions. Nogwazi, you can slide your presentation and so that we proceed.
Morning, Chairperson. Am I audible?
Hello. Yes.
Hello, sir. Can you hear me?
Yeah, you are audible. You may proceed.
And the presentation is also showing.
Yes.
Thank you so much, Chairperson. Good morning, Chair and the honorable members and the senior management. I'll be presenting the review on quarter 3 and quarter 4. I will, through you, Chair, I'll move straight to the operational plan, and my focus will be on what has been amended in the 2 next quarters, the current quarter and quarter 4. I'll move to page 10. The consideration of Gauteng Department of Health annual reports. Since the annual reports are not ready for the committee to deal with them in quarter 3, so also we had to align the operational plan for the annual reports to be dealt with in quarter 4. I will move to the next activity. And we also did adjustments on the public meetings. This one is dealing with the annual report. We have scheduled a public meeting to deal with annual reports. We will also be guided as well as per the presentations that were made earlier on, if the committee will be able to engage on the public meeting, or will continue to do the virtual meetings, and then we can invite stakeholders for inputs in this meeting. The next item is the committee has to conduct a feedback, a stakeholder engagement session. The committee is due for one this quarter and one in the next quarter. As per the term program, when it will be presented, the committee will note that there's one scheduled for this quarter, and then when the planning for the next quarter will be presented, the committee will also plan to conduct another one in the following quarter. On the table, round table discussion, we have conducted one in the previous quarter, which was quarter 2. The next one will be in quarter 4. On participation in the national conference, the committee will remember that we had planned a conference earlier in the year, but the committee couldn't attend due to COVID-19, and that conference was postponed to December this year. Through communication with the Office of the Chair of Chairs, will be guided if the committee will be able to participate in this conference. So we have left it in quarter 4, since we have moved it from quarter 1 to quarter 4, and then we can get the guidance from the Chair of Chairs office if the committee can be able to attend this conference, because it has been on the committee's plan. On the participation in the NCOP debates, the committee attended the virtual one in quarter 1, and the next one will be in quarter 4, where the NCOP will be debating on the annual reports, and will also be guided if this will be a conduct meeting and a virtual meeting. But the committee will be able to participate in the virtual meeting as well, because we also get invites on virtual debates on these meetings. The meeting with the AG's office, the next one will be on the next quarter, which is quarter 4, where the committee will be dealing with the annual reports process. The next item that we have adjusted, it's the meeting with the Section 79 committees, Section 80. The committee in the previous quarter, we have had a meeting with the PSC, and then we are planning another meeting for the current quarter with the Human Rights Commission. So the committee will be able to achieve these targets as their plans in line to actually conduct these meetings, and the other one has been achieved already. Thank you so much, Chairperson. That will be end of the reviewing of quarter 3 and 4. Thank you so much.
Thank you very much, Nondumiso. I think we can take all the presentations and the discussion will be done at the end. And I hope honorable members are noting their areas of concern. Let's go to the review of the committee operations plans for 2021 and 2022 financial year. And Ms. Gidi, can you please present one?
Thank you, Chair. I just want to check if the presentation is visible on the screen.
Not yet.
I'm going to try again, Chair.
Okay.
Is it viewable? Is it visible, Chairperson?
No, not yet. Can Nondumiso assist in flighting it on your behalf if possible?
Chair, it's visible. I can see it.
Is it?
I can also
Then-
see it, Chairperson.
Okay, then you can proceed.
Okay, great. Thank you, Chairperson. I am presenting the review of the operational plan for 2021-22. Members will remember that the committee did have a strategic planning session last year where they planned for a period of 5 years, and this is an operational plan that is being reviewed, taking into consideration what was agreed upon in the previous year. I am going to go skip the first part, which is the part that deals with the approvals, as well as the second part, which is dealing with what the chairperson of committee's session spoke about this morning. And I am going to go straight to part C, which speaks on performance and measures. These were the committee 5-year deliverables that were discussed in the past year, and they were basically speaking on the targets that the committee will have to make sure that they deliver on in the next 5 years, mainly the oversight reports on annual budget vote, the quarterly reports, the FIS's oversight visits, as well as yes, all the oversight reports, Chair. And then the second part of that is dealing with the public meetings that the committee should have, the stakeholder engagement sessions, committee inquiries, Buali Sichaba, and the roundtable discussions, as well as the initiation of bills and the process of referrals. And then the fourth line item deals with the collaboration with organs of state, which is inclusive of international study tours, conferences, national conferences, and so forth. 3.2 deals with the committee stakeholder plan, whereby the committee identified some stakeholders on its operational plan, and they were included as stated there, which were departments, institutions of higher learning, research institutions, municipalities, Chapter 9 institutions, as well as the community-based and non-profit organizations and professional council for help, as well as the method of engagement, which is always stated to be public meetings through committee inquiry, stakeholder engagements, Buali Sichaba, taking legislatures to the people, roundtable discussions, as well as the relationship building sessions. The committee is welcome to amend this if there is a need. There is also a corporate governance plan that was discussed by the committee in the previous year, and that included the institutions such as the AG, the municipalities, the NCOP, other provincial legislatures, the Gauteng Department of Health, the national conferences, as well as through international conferences and study tours, as well as sectoral forums. So the top part was already discussed in the past year, but the committee is welcome to deliberate and make amendments if necessary. With regards to 3.4, there is a new section that has been included in this OPP's template, and that deals with the committee training plan. I've just inputted some of the ideas that the committee may want to think of as wanting to add into their training plan, but the committee is most welcome to make amendments to exclude or include more of the training that they think should be incorporated as part of this OPP. I've just stated on lawmaking. The training identified will be the lawmaking skills, preferred mode being physical training, and it can be undertaken in the second quarter of the 2021-22 financial year, as well as training on social media management, which can also be looked at as part of the committee's training plan. Then I'll go straight to the operational plan, Chair. For the year 2021 and 22, in terms of the operational plan, the first part is to table a report on annual report, which is an oversight report, and that is always done during Q3 of the year. And then the second one is the budget vote for, which is done on Q1. And then it's followed by the oversight reports on the quarterly reports, which is done in each quarter, as well as the 2 focused intervention studies that are undertaken during Q2 and Q4. And what is mainly required is for the researcher to make an input on all of these. There's always a public participation that is required, and we also collaborate with different units within the legislature to ensure that these activities run smoothly. But most importantly, the Gauteng Department of Health needs to be on board. And then the next part, Chair, is dealing with the committee oversight visits, whereby we always ensure and will need to ensure during this financial year that there are oversight reports on the oversight visits that have been undertaken. They are either collaborated or included in the quarterly reporting, or the committee can have them as a standalone report as they have been. So in each quarter, the committee undertakes oversight visits, and there are reports that are generated and adopted and tabled by the committee. I've also just created a slide which was for information that was shared with members on email, a slide on all the oversight visits that have been undertaken in terms of facilities, that out of these many hospitals, the committee has only been able to conduct oversight visits on only 5 hospitals, as well as the clinics. I think there were 3. So that means that the committee might want to look at a plan on how they are going to make sure that they conduct oversight visits in most of these facilities, although it cannot be all, but just to make sure there is improvement in that regard. And then with regards to public meetings, the committee is going to be having a public meeting during Q1, during the budget vote, as well as during the annual reporting, which is in Q3. And then stakeholder engagement sessions are scheduled or are being proposed to be during Q2 and Q4, and as well as feedback sessions for the stakeholder engagement sessions that would have taken place during Q1 and Q3. There is no Boale Sechaba according to the planning schedule that we received that is scheduled for the committee in the coming year, but we have inserted it under year 22, year 23 as a target that one Boale Sechaba can be held. In terms of committee inquiry, we've received a directive from the chairperson of committees that the Committee of Health is scheduled to conduct a committee inquiry on EMS during the year 21-22, and I've inserted it under quarter 2 just so that maybe planning is done during quarter 1, and also to check what are the requirements as well as how are they affected by COVID safety measures. And then with regards to the next one, which is roundtable discussions, the committee is always aspiring to have a discussion in a form of a roundtable, whether it's virtual or not, with any affected party, and this has been scheduled to take place in all 4 quarters, 1 per quarter. In terms of bills, we have not had any referrals as yet, but we do not know in the near future what is going to happen in terms of referral. Hence, there have been none that have been put there, but they are dealt with as and when they are being referred. In terms of international conferences, the committee is not scheduled according to the schedule received from the chairperson of committees to have an international conference during year 21-22, but it is scheduled to undertake an international conference during year 22-23. And then in terms of national conferences, the committee is always attending a national conference on HIV/AIDS during quarter 1 in June, as well as during quarter 3, the PASA conference. And then in terms of national NCOP debates, there is always attendance by the committee during quarter 1 for the budget votes, as well as the annual reporting during quarter 3. And then in terms of the meetings with the AG office, they are forever invited in the committee meetings, and they are always looking forward to making sure that they have been invited, just so that they can pick up all the issues that are being dealt with as they relate to the Department of Health. But mainly it is important that they are included as part of the budgeting process for the Gauteng Department of Health, as well as the annual reporting, which is quarter 1 and quarter 3. The interprovincial visits, according to the schedule from the Chair of Chairs, there is none in this year under review, which is 21-22. But during the year 23-24, there is an interprovincial visit that has been scheduled. And then in terms of the international study tour, as reflected on the schedule by the chairperson of committees, the committee is due to undertake an international study tour, which has 2 legs, Africa and international outside of Africa. And this report we should make sure that we have a report by the end of quarter 4 of 2021-2022. And then meetings with Section 79 and 80 committees, the committee should always endeavor to ensure that with any meetings that they are having that require public participation, there is collaboration with local government, and therefore it's been scheduled on all 4 quarters of the year. In terms of the key risks and mitigation, these were the ones that were identified in the past year, but the committee can also amend or add onto these ones that have been mentioned. The first one being on stakeholder engagement session, the stakeholder submission on the performance of the department, and the mitigation is to strengthen the stakeholder mobilization tools. And then the second one being on the non-compliance or late responses by the department in terms of committee questions and house resolutions, and the mitigation being to strengthen internal systems to ensure that the committee questions and house resolutions are responded to timelessly by the Gauteng Department of Health. The third one is the appointment of senior positions, permanent senior positions in the department, as that impacts on the committee's effective oversight and implementation of committee resolutions that would have been taken, because when they change, there is lack of accountability. So the mitigation would be to ensure that the senior positions in the Gauteng Department of Health are appointed on a permanent basis. That is my presentation, Chairperson, and thank you.
Thank you very much, Nogwazi, for the presentation. Excuse me. The next presentation is on the budget outlook for the committee. Can I ask the budget officer to present this outlook for the members of the Department of Health? Thank you.
Chair, I do not see Ms. Delayani as being logged on, but if the chair can allow me to just call him and find out if he's able to join or not. But he has been the one that has been allocated to the committee to present the budget outlook. I'm just going to quickly check with him.
But he was aware, Mus, that this committee is going to meet at this time. Okay, while you are calling, honorable members, there is the two presentations, with the first one by Nondumiso and the second one by Nogwazi. I think when she raised the issue of public meetings, so those are not yet allowed. We will continue doing the meetings virtually. And yes, we're not yet allowed to go out there in the community to do meetings. I'm talking about the first presentation. The national conference is also affected by the COVID-19, so there is no possibility of us going to a conference in December. Honorable members, there is the first presentation. Can I take hands for those who would like to make any comments? I'm using my cell phone. I'm not able to see the two hands that are up. Can you unmute and say your name, then I can note you?
Chair, Member Fuchs.
Thank you, Member Fuchs. Number 2.
Member Mabala.
Thank you, Member Mabala. In that order.
Chair, thank you very much. I think we're all aware of the fact that as a committee, our responsibility is to hold the executive to account. One would think that within that context, that the input from the committee would help to improve the performance of the department. Now, my perspective, Chair, is that we spend hours and hours talking about various things, reports and issues. And when you look at the performance of the department, certainly statistically, it does not improve. In addition, the department lurches from crisis to crisis. Okay, we go on oversight visits and we pick up issues that, in my view, should be managed in the day-to-day management by the hospital staff, but that doesn't seem to happen. So overall, Chair, this committee, in my view, is really just a talk shop, and the value that we're adding, you know, in terms of the improvement of the department is negligible in my view. So, you know, when we go, for example, on an oversight and you talk to staff, you find people extremely reticent to discuss openly the issues they might have. It's almost as if officials in the department are afraid to speak out. And so on that basis, Chair, to my mind, there's one element that I believe we can utilize in order to deal with this matter. I'm really concerned about the organizational culture and the processes when it comes to the day-to-day management of the department. And in order to deal decisively with those elements in a transparent way, I would really like to propose that we consider a committee inquiry, which will focus on the organizational culture and processes as far as management is concerned. You know, I ask myself the question, how did it happen that this PPE debacle just came out of the blue? There has to be something wrong with the organizational culture, the management culture, the oversight. And on that basis, as I say, I'm proposing, Chair, that we consider a committee inquiry that will look into the organizational culture and processes when it comes to the management of the department on a daily basis. Thank you, Chair.
Thank you very much, Honorable Fuchs, for that suggestion. Member Mabala.
Thank you, Chair. I think we must all agree that the Department of Health is in crisis, and it has been like this for many years now, because if you look at the trend of the leadership in this department, you find that most of the time the MEC doesn't even finish his or her term, and the HOD, there is this trend that I don't know. I mean, I served in this committee in the previous administration, and I must say that I have seen so many HODs and acting HODs and CFOs, and it cannot be correct, because the department is in crisis under our watch, and we as the health committee, it is our responsibility to make sure that the committee accounts to us. So I think I should agree with the previous speaker that we should make sure that we're going to be firm when it comes to the department accounting to this committee. I think actually we must, they must come and appear in front of the committee so that we can be able, you know, to get to the bottom of this, because it cannot be correct that things are happening under our watch and you know, it's business as usual. Like, so a lot of money it disappears in this department, and people are getting away with it. I think it's about time that the department must appear. It must be a commission of inquiry. They must come and tell us what happened to certain issues, because I mean, we're dealing with health here, which is one of the most important, it's a basic human right, actually. So for us coming here, presenting these slides year in, year out, it doesn't serve any purpose, Chair. So I think it's about time that this current health committee under this sixth administration should hold the department to account, because people will come, people will go, will be replaced, and they will come and do corruption, do so many things that are unlawful. And knowing that in that department of health, they will get away with it in Gauteng. So I think it's about time that we call them to come to the committee to account. And another thing, I see the slides that have been presented to us. I must say that, you know what, we must maybe sit down and restructure, because we cannot be going on like this. Some of the programs here, they are duplicates. For instance, when you say we have stakeholder engagements and we have public meetings, and then we have Bualisi Chab, we have roundtables. I mean, those engagements, some of them are duplicates, because if you are saying today you are going to call a public meeting, the public meeting in Bualisi Chaba for me is one and the same thing. Because if you're calling, you go into a community, let's say you go to Tembisa, you call a public meeting, and then 2 months later you go to the very same community, say Bualisi Chaba. It's one and the same thing. It doesn't serve any purpose. So we need to relook and review these programs, because I mean, these programs, there is a budget that is allocated. Why should we waste taxpayers' money on having duplicates programs, whereas we can come up with a certain strategy, you know? Visit all these hospitals. We have so many hospitals in Gauteng. We have so many clinics in Gauteng. And by the end of this term, I can promise you, you would find that we didn't do our communities justice, because you'd find that we didn't even visit some of the hospitals. We need to be on the ground. We need to go and identify those problems and come up with solutions as a committee. And, you know, moving forward, I think we should do that. We cannot come here, year in, year out. It's cut and paste, cut and paste. We're coming with the same thing. It doesn't work for the committee. So why should we repeat the same programs that are not working for this committee? That is my input. Thank you.
Thank you very much. Assist by providing the suggestions so that this repetition excluded, because our community in Gauteng is very large. So my thinking is if one program is done in one community, the other will be done in another community. However, you can still perhaps provide some suggestions so that we include into the strategic plan. And then with the committee is coming to be presenting to us on Thursday, so another opportunity will be made available for them to answer some of these challenges that we are experiencing as a committee. I think with regards to the committee inquiry on organizational culture, I think this we can take it up and include already into our current strat plan that we are busy dealing with. I mean, this OPP for this time around that was presented. So it's also a good suggestion because the department is experiencing a lot of issues. So in that, I think we can move to adopt the report with the suggestion that is made. Do we accept the report?
Madam Chair, Member Jack Bloom, sorry, I did put my hand up late. Could I just make a comment?
Yes, Member Bloom.
You know, we spend a lot of money to the infrastructure development department, and I think we just need a closer scrutiny and accountability for our relationship with the infrastructure development department. Is there any way to strengthen that in our operational plan? Or maybe this is just a comment, to be honest, but huge, and we see it with the with all the quite frankly the scandals with the PPE contracts and the other contracts. We just need to strengthen our relationship with oversight over the infrastructure component. That's just the comment I want to make at this stage. Thanks.
Thank you very much, Member Bloom. I think from the Chair of Chairs meeting we had previously, we need to make a relationship with that committee of infrastructure going forward. I think it's something we are considering, so that health committee plus that committee, they meet and map a way forward together. Your comment is also valuable. Do we accept this report and move to the second one with those additional comments? Hello, are we still here?
Yes,
Honorable
Chair, agreed.
Thank you very much. Thank you very much, Member Fuchs. Can we move to, or any seconder?
Chair, I second.
Thank you very much, honorable members. Let's move to the presentation by Nogwazi. That was the review of OPP for 2021-2022 financial year. Any comments on that report? Okay, we accept the report and move on.
Yes, Member Mabala.
Yes, honorable member. Any other member?
No, Member, I need to make a comment on this report.
On the second report.
Yeah.
Yes. Let me also take other hands before you speak, member. That's why I'm saying any other members, so that you number one. The next member, is there anyone who would like to make a comment? Okay, proceed, Member Mabala.
Okay, thank you, Chair. It's with regards with the invitation of the Auditor General's Office. I think we must also try to strengthen our relationship with the Committee of Public Accounts, SCOPA, because many a times you find that the Auditor General is when there are actually like hearings from the departments, you find that the Auditor General's office is also there. So it would be, I think it would be appropriate if we can be invited when the health department is invited to the SCOPA committee. So that is my suggestion. I think it will strengthen our portfolio committee as well. Thank you.
Yeah, thank you very much. I think we can engage Honorable Kanyile, who is it Kanyile? No. Yes, SCOPA, yes. So that we strengthen our relationship there also. Thank you very much, Honorable Member. Can we, Member Bloom, are you, I saw your mic is moving. Are you moving to, you'd like to say something?
No, I just neglected to switch.
Oh, okay, thank you. Do we accept this report with that addition of a relationship with the SCOPA?
Madam Chair, we can accept the report, Member Bloom.
Thank you very much, Member Bloom. Seconder. Honorable members.
Second.
Thank you, Member Food. I hope the budget officer is with us now. We're moving to that one. We couldn't do it because there was no one to do it for us. Is the budget officer present, Nogwazi?
Yes, Madam Chair, the budget officer is present now.
Thank you, Mr. Rawat. They can proceed.
Thank you, Chair. I'm going to present on behalf of Liani, because he's still busy with sports. I'm going to take you through, this is Tabisen, sorry for coming in late. We're going to talk about the committee's previous year actual expenditure, and then move to the current year media actual, and then lastly, the budget guidelines and timelines. With the 3-year financial expenditure, the committee has spent in the first year of the previous year, 2017-18, they spent 117%.
Sorry, Ms. Ntabiseng, do you have any presentation to flight?
Yes.
Oh, I'm sorry, ma'am. I thought you can see it from your side. I did flight it. I'm sorry.
Maybe yes. Me, I'm having a problem. If members are able to see it, then it's fine. Proceed.
Can everyone
see it?
Not visible.
I was also about to request that. Can the presentation be on the screen? Thank you.
It is shared. I don't know if you can. Okay, I don't know what's happening, but it's shared.
Tabi saying if you are able to just kindly send it to me on email so I can flight it.
Okay. I'm speaking to
Nogwazi, coordinator for the group.
Okay. Did you receive it, Nogwazi?
Not as yet.
I see that Lion is coming in. Perhaps he can meet up.
Yes, I'm in.
Okay. Lani, can you fly the presentation, please?
All right. Good morning, colleagues. My sincere apology for late. I was attending another meeting with community safety. I just left the meeting after responding to question. My humble apologies to honorable members and colleagues for the delay this might have caused. I will quickly go to audited actual expenditure for 3 financial years. If you look at...
Hello, can you make a slide presentation, please?
I've done that. I've shared it. I'm not sure whether it's not shown on your side.
It's showing, Chair.
It's visible.
If you can
I've
do
done
the
that.
slide presentation, yes, it's there, but if you can make a slide presentation, like when you go to a certain icon, it will show one slide only. I'm using a cell phone, that's why I need it to be bigger.
I just want to find out from other colleagues if they understand what honorable member is asking so that I can do exactly that. But are other colleagues having challenge on the same matter? Because I don't know what must I do
not
now.
at all.
Okay, press FN F5.
F what?
FN F5.
FN F5. FN.
Yeah, it must be in the presentation mode.
Okay, let me look for FN F. I see F5.
Yeah, you must press FN F5.
I see F5. I don't see FN. FN. I don't see it.
Layani,
look at one slide, and at the end of the slide towards your right, there is an icon that is holding something like on top of the small line. You press that thing, it will show one slide, and you are just going to go with the arrow to the next slide.
Is this fine now?
Yes, this is what I was asking for. Thanks.
Thank you. All right. And sorry for that. And again, I apologize for the delay. And then I will quickly speak to audited actual expenditure in the past 3 financial years. If you look at the performance on 2017-2018, we overspent only by 17% of the allocated budget of 3.2 million. And then in 2018-2019, we also overspent by 114% of the budget that was allocated at 2.3 million because we spent 4.9 million. And then in 2019-2020, we underspent by plus minus 22%. We spent 2.9 million of the 3.8 million. But the issue is that when you look at the percentage in terms of spending, we see the highest spending percentage on area of transport and shuttle events, 107%, and subsistence and travel at 143%. Subsistence and travel in 2018-2019, it is 217%. So the major contributing factor to overspending is the area of accommodation, subsistence and travel, transport and event, and so on. And then as well as public outreach program. So that's the audited actual expenditure for the past 3 financial years. And the next slide is talking to an amount of 3.8 million has been allocated to the committee 1920, 78% I've spoken to that. The underspending of 843,000 is due to the stakeholder engagement with 200 members of unions in the Gauteng Department of Health on EMS performance was, or due to 200 members of unions in the Gauteng Department of Health on EMS performance was due to COVID-19. So now, the next slide that is shown now, it represents the budget that has been allocated in 2020-2021 current financial year. The budget that has been allocated is at 2.4 million. And the projection from April to September is 727,000. To date, we spent 285,000. That represents 12%, of which we've got a variance of 442,000. The budget that is available to spend is at 2.1 million before we embark on the exercise of adjustment that is underway. The major budget activities are as follows. The meetings driving the budget are the annual report public meeting at 1 million, committee oversight visit at 459,000, domestic travel at 455,000, FIS emanating from budget vote 4 and annual report at 355,000. As at the end of September, the committee has spent 285, which is 12%, on the following activities: payment of travel claims at 242,000, stakeholder engagement session transport 28,000, expenditure incurred in the previous financial year, however, not accrued, catering for meetings at 15,000. When comparing the expenditure against projections of 727,000, the committee displays an underspending of 442,000. The underspending is in respect of domestic travel related to NCOP, debates and interprovincial visits that could not be undertaken due to COVID-19. Now we are presenting the institutional budget picture and guidelines. The institutional budget in 2016, those are the receipts from Treasury, the actual and 2021 medium-term expenditure framework outcomes is showing that 650 million has been allocated 2016, it's the outcome of 2016-2015. The outcome for 2017-2018 is 675 million, an increase of 4% compared to 16-17. 2018-2019, 700 and
I think you are muted because we can't hear you. Ryan. Are you able to hear Ryan?
Hello?
You were inaudible. I thought you were muted because we were talking about the 4%. From there, you vanished.
Oh, sorry for that. It's a network. It's also showing that there's a bad network. Am I audible now?
Yes.
Sorry, honorable member, for that. I was saying that in 17-14, there's 675 million. That is the outcome in terms of the receipt from Treasury, the actual expenditure from Treasury. And then in 18-19, the outcome is at 16 million, representing 6% growth. And in 19-20, the outcome is at 761 million, representing 6% growth. Now, in the adjustment appropriation of 2020-2021, the institution has been allocated a budget of 818 million. That represents 7%. And over the MTEF, the budget is growing by an average of 5%, as you can see, which is 858 million in 2021-2022, 908 million in 2022-2023, and 947 million in 2023-2024. And then now we look at where are we most spending our budget on. In 2020, if you look at this, most of the budget is sitting under compensation of employee at 408 million. And then followed by goods and services at 551 million. And then transfers and subsidies, 143 million. That is constituency allowance and political party funding. Political party funding has been allocated 85.6 million, and the constituency allowance has been allocated 56.9 million. And then we also have capital assets that is at 15.4 million. The actual expenditure at the end of August, under composition of employees who spent 164 million, that represent 40%. Goods and services, we spent 35.8 million, that represent only 14%. We are on par in terms of transfers to political party funding as well as constituency, because we have spent almost 77%, that is 110 million, broken down into 24.4 million, which is constituency, and 100% allocation to political party funding. The picture also is, we show that we have spent 299,000, that represent 2% on capital assets. Now, the indicative baseline follow the same sequence. I will only highlight the indicative baseline here under 2021-2022. The budget for composition of employees is going to be 436 million. Goods and services is going to be 268 million. And then that the two items represent the growth, and composition of employees will be growing by 27.4 million, that is 7%. Goods and services will be which has increased by 10%, 8 million, a decrease by 76% in order to cater for other increase such as political party funding. So the budget literally in 2021-2022, the institutional budget will have increased by 40.3 million. And then that will take the budget to 858 million. That is equivalent to 5% increase. So you can see over the MTEF, the budget will be on 2022-2023, 907.5 million, 6%, 947.4 million, 4%, and yeah, that is the budget that is going to be like the picture over the MTEF. And then the key point to note on the 2021-2022 indicative baseline is that the indicative baseline for GPL is per the published provincial budget statement for 2020 medium-term expenditure framework. The 5% that I was referring to in terms of increases only to cater for inflation. Composition of employees in the 2020 is already taking 50% of the budget. And we are expecting that in the next financial year, 2021, the composition of employees will also consume 51% of the budget. Any increase in composition of employees beyond the projected salary adjustment from Treasury to fund compensation of employee increase, as alluded by the Minister of Finance during tabling of supplementary budget in June. All baseline must be assessed from scratch and justified. That is, we cannot simply copy and paste the previous year's budget. It must be interrogated and justified. 2021 key budget principles. GPL budget is limited. GPL budget limited to the 2021 indicative baseline. there's no additional prioritization and trade-offs necessary to ensure that funds are allocated toward policy priorities. Prioritization of core output over non-essentials. Doing more quality work with less resources. Implementation of cost efficiency measures and standard costing rates during costing of plans to be attached on the IDU. Adoption of the fiscal responsibility during costing. Alignment of financial plans to 2021-2022 operational plans and ultimately institutional annual performance plan. Assessment of capacity and the ability to spend the proposed budget. That is very important as well. Interrogation and assessment of the budget bids to determine alignment with institutional priorities. Credibility of costing is expected. Implementation of cost efficiency measures and affordability of the plans. 2021 budget reforms and formats. Budget reforms, introduction of gender-responsive budgeting and spatial referencing of the budget. It seeks to increase gender.
Oh, you have a very bad connection there. Sometimes you are
participation in the budget process. Okay, my apology for the poor network. I'm trying my best to connect. Let me start again on the 2021-2022 budget reforms and formats. Can you hear me now, Honorable Member?
Yeah, if you can just maintain that position, you are audible.
Yeah, I'm trying to move around. Yes, thank you for that. The budget reforms, introduction of gender-responsive budgeting and spatial referencing of the budget. It's aimed to increase gender-responsive participation in the budget process. It is also aimed to advance gender equality. It is also to plan and budget in line with the corridors of development. Budgeting over the medium-term expenditure period is essential to ensure alignment to annual performance plan and operational plans. Operational plans is the first step in preparing a functioning budget. Important to develop operational plan with clear activities before costing. Operational plan will ensure that activities are easily costed and funded on the IDU budgeting tool, whilst ensuring a clear link between budget and plans. Realistic budget profiles, that is, planned activities and financial resources must be broken down per month in line with the expected implementation date. The final approved budget captured on IDU will be to certify, which should be implemented monthly on reviewed quarterly in line with changing circumstances. And then budgeting templates, the tools that we are going to use as a budgeting template. So we're still going to use the IDU as our budgeting tool. And the IDU is just a web-based budgeting tool that streams and automates data capturing. It allows for 3-year budgeting over the MTEF period. It's also able to link budget to GPL outcomes. Complete 2021 operational plans required for credible and informed costing. Now, what is new? You will remember previously I indicated that the budget seemed to address issue of GRB. So now the IDU will be designed in such a way that it caters for gender profiling of budget in terms of regions. It will also cater the issue of women category, men category, youth people, and people with disability and race and so on. It will also to benefit out of this budget the institution is going to implement. all the regions in Gauteng. Now, this is more of administrative part by GCC and the administrators, and not necessarily part of honorable members. There are items that they know that are centralized in other business unit or sub-programs. So what you see on the left-hand side, those are the items that are centralized. What it means that if the committee of health want to advertise, the budget for advertising will not be sitting under health, but it will be sitting under communication business unit as an example. So all those activities, if they relate to the committee must see to it that they complete the necessary template that will be provided so that this budget is put under the responsible business unit, so that when time arises for them to conduct committee inquiries, sector fora, and so on, they should have been catered for in terms of the budget. On the right-hand side, those are the program or the business units that are responsible for each and every, for each item indicated on the left-hand side along the same line: subscription fee, information center, license, laptop, ICT, and so on. So this still stay the same. It doesn't change. We are not going to allocate these items on the committee itself, but to a particular business unit that is responsible. And then what do we seek to see on GRB? On all the activities that are key, but we're not limiting to these activities, but we know that committees on the following activities: public hearings, public meetings, stakeholder engagement, focus intervention, roundtable discussions, sector parliament, taking people to parliament, and so on. So we want to see the budget responding to those activities. In other words, we want to see the budget speaking to this in terms of GRB, women, men, youth, people with disability, race, and the regions as indicated. Now the budget timelines. Costing of committee operational plan on IDU is expected to kickstart from tomorrow until the 19th of October. That is the 13th to 19th of October 2020. IDU will be provided from tomorrow from 9 o'clock to 12:30 to GCC and administrators in terms of just to indicate in those new changes and so on. Presentation of committees budget and approval by chairperson of committees and speaker's budget council to be confirmed. Submission of the GPL 2021 medium-term expenditure framework second draft budget to Treasury is on the 13th of November 2020. Budget officers will be available to assist on technical matters. Committees requested to adhere to costing timelines, and the adjustment budget due on 14 October 2020. Templates already issued to committees on the 8th of September. So the due date to submit is the 14th, which is the day after tomorrow. Honorable members, my apologies for bad net quality audio and the network and the late arrival. And that's in a nutshell the presentation. Thank you very much.
Yeah, next time we must also prioritize us and go late to other committees. Honorable members, there is the presentation. Any comments? Any
Madam
comments,
Chair?
honorable members? Yes, a member Bloom. Another
no,
member.
Yeah. Can I go ahead?
Yes, please.
Thanks. I mean, I'm just looking at those amounts. 1 million rand for one public meeting on the annual report process. I mean, of course, we've all been to these, but they seem to transport people from right around the province and to some not the best venue. I mean, quite frankly, if we did it at and obviously there's problems doing it now during COVID, but I don't know why the legislature isn't the best place for these meetings. The City Hall, much better, it's central to the province. And I think R1 million seems to be quite excessive. I mean, you've got to cart all the translators and the recording equipment, etc. Seems to be a City Hall would be event as good as any to do it. Just a comment.
Thank you. Any other member? Member, please, the person who is having noise, can you mute yourself, please?
Is it? I don't really want to say. It's too hard for my teeth.
Member Fuchs, please mute yourself. Member Fuchs, please mute. Okay, there is no other member who would like to comment. Member Mabala.
Yeah, on that one of the 1 million that was spent on a public meeting, I also would like to get a breakdown, detailed breakdown, because usually what happens is when we have these public meetings, we see taxis transporting people from different areas, but we don't even know as a committee, Uguti, how does it work? Who goes out and invite the stakeholders? Because I mean, I think as a committee we should be there should be transparency in terms of that. And I think it's a lot of money to spend on one public meeting. Thank you.
Yeah, thank you, honorable members. Yeah, the transport that is used also is problematic because it's very old and very much unsafe. That's why some of us, we will never use it. Sometimes it's unsafe to use those taxis. So even the catering, if you find somebody carrying food from Sidibeng to Westland, that is also problematic. But otherwise, there are the few comments when Layani, any response?
Honorable member, thank you once again.
Can you mute your mic, please? I mean, can you ask them or close the door behind?
My door is closed, honorable member. I'm in the sort of library, sort of in the home at home. So it's just that the child is crying that side, it's far away from me. Sorry for that.
Okay, proceed.
And then I'm saying I think it's more of a comment made and also seeking more clarity on the breakdown in terms of public meeting spending of 1 million that can be provided to your office. We'll provide such information.
Time frame.
I've noted down time frame. Let me say, give me until Wednesday.
Okay, Nogwazi, can you please note this time so that you make follow up on behalf of members?
It can be even earlier than that, but Wednesday will be able to provide you the breakdown in terms of what makes the 1 million on public meeting.
Okay,
and
thank you.
Yeah, it can be earlier than that. And then I think the concern that honorable members are raising are equally our concern if we look at high spending that we perhaps to say what is exactly out of that. So the reason why we are saying we'll be able to give you such information is for your own self to have a look at what we are seeing every month when we are reporting. But I think the CFO, perhaps the colleague might even add if they do have to add. But it's just for me, it was more of comments than any other things, which we are willing to provide the breakdown for public meeting spending. What makes that 1 million will give you the full detailed account of that. And the committee will take it from there. Thank you very much.
Thank you very much. CFO, any comment?
No, thank you very much, Madam Chair. No comments from our side, only that as Liane has committed, we will provide any detailed breakdowns as required, which will assist the committee in making a determination of all the activities that was carried out. Thank you.
The report is noted. Anyone noting this report?
Chair, before you can you can adopt or note the report, can I make a comment?
Yes.
With regards to that detailed report, I don't know whether it will be from the office of the CFO or Triple P, but also as a committee, can we be provided with a criteria that is used to identify stakeholders? Because usually when we go to these meetings, we just see those transport combis or taxis bringing people, but as a committee, I mean, we should be provided with a criteria that is being used to identify those stakeholders. Thank you.
Okay, Non-Dumiso, I think Njabulo Buthelezi is part of the outreach, that ensure that the stakeholder is coming. Do you want to comment on that?
No, Chair, it's no worries. I just wanted to state that we will definitely follow up with Liane with regards to the breakdown of the budget. But however, on the annual report public meeting, I know that the number of stakeholders that were targeted were 1,200 from each region, but we can also maybe get a report from public participation on how do they make sure that they get the correct stakeholders and how do the process whereby that they utilize when they go out to get the stakeholders that are relevant for that committee meeting that is sitting outside the legislature. So it would have been for 1,000 people, which is inclusive of catering and transport from around the region, being 5 regions, that will transport 1,000 people. Also, I just wanted to answer to Member Bloom's request that a public meeting can be held in the legislature city hall. It's very much possible, but however, members sometimes would like to rotate the regions and not just have a meeting on one region, which is the city of Joburg. But I'll also follow up with Liane with regards to the detailed budget as how it equates to R1 million. Thanks, Chair.
Okay, so you'll talk to the public participation office also so that they identify how they pick up the stakeholder into a public participation. So time frames from yourself.
Chair, I can speak to Njabulo today and probably will have a report by, today is a Monday, by Wednesday.
Okay, so those 2 reports will be expected on Wednesday. Thank you very much. Can we note the report? Is that fine, Member Mabala? By Wednesday, we are expecting the reports on the breakdown and the one on identification of stakeholders for participation in our public meeting. Is it okay by Wednesday, Musne?
Yeah, it's fine as long as it can be by Wednesday, not Thursday, because usually
Okay.
when we are being promised reports, they don't reach us on time.
Okay, thank you very much, Member. The report is, can we approve the report? Honorable members?
You can approve, Madam Chair.
Thank you, Member Bloom. Any seconder? Any seconder?
Chair, second.
Okay, okay, thank you, Member Fuchs. Honorable members, our officials and support staff, CFO and the team, let me take this opportunity to thank you all for participating in our strat plan. Thank you. We appreciate it. The meeting is adjourned. Bye-bye.
Thank you very much, Madam Chair.
Goodbye.
Bye.